Suicide is a major public health issue in our state. It is the second leading cause of death in Idaho for those aged between the ages of 10 and 44. That rate is 46% higher than the national suicide rate. And this is not a new or a recent development. It's been like this for decades, and the mission now to curb that has just gotten stronger. St. Luke's is leading a research study now to help prevent suicide in our state and across our country, and has received a near $3.5 million research grant from the Patient-Centered Outcomes Research Institute to conduct a suicide prevention research study that is known now as the Suicide Prevention Among Recipients of Care trial. It will be the largest ever suicide prevention study ever conducted in the state. Leading that study from St. Luke's is Dr. Anna Radin, and also with us today is Jessica Torres with the Idaho Suicide Prevention Hotline. We want to thank you for joining us. Doctor, I'd like to start with you with how St. Luke's was chosen as the recipient of this grant and the process that follows the awarding of it. This is a really, really big deal.
Yeah, thanks for the question, Mark. We applied for a research grant because once we started looking deeper into the science around suicide prevention, we realized there really are a lot of gaps in what we understand about how best to support young people and adults living with suicidal ideation. So once we realized there were a lot of questions that are outstanding in the scientific literature, we thought, well, this is a space where we can contribute and do some really meaningful research.
What is the background, and everybody asks me this, as you know, I'm very affiliated with the Speedy Foundation and the late Jared Speedy Peterson, who died by suicide 10 years ago, a little bit over 10 years ago. What is the reason why the state of Idaho has such a high suicide rate? Is that part of what this research will hopefully uncover?
That's a great question. The focus of the research is not so much on kind of what's driving research for suicide risk in our state, but it's really focused on how we can help prevent suicide for people who are struggling. We know that suicide is preventable, and we know that sometimes doing something that seems really simple, like sending a text message or having a phone call to let people know that there's support out for them, that they're cared about, that can make all the difference in the world to someone. So this study will be comparing two evidence-based versions of follow-up support delivered by the Idaho Suicide Prevention Hotline to people who are struggling with suicidal ideation. And at the end of this, we want to see which one works best. We know both of them are good. We know both are effective, but we want to see, is one better with teens and adolescents? Maybe one works better with older adults. And that way, moving forward, we'll be able to do the very best possible care and deliver that to our patients through our partnership with the hotline.
We mentioned that Jessica Torres, is she with you, Dr. Radin? Is she there?
Yeah, she's logged on as well.
Okay, Jessica, can you hear me?
I can.
Let me ask you about the number of calls that you've received in the last 18 months and how that compares to what happened before the start of the pandemic.
So we have increased our call rates year over year. Basically, the hotline has been in existence for 9 years now, and year over year, we have an increase in contacts, people reaching out for help. And August of this year, we had our record month with nearly 1,700 calls from people seeking help in Idaho. So there is definitely a need in the state.
What is the need that you have right now there at the hotline? As you know, the hotline was, it went dark after a long period, and it wasn't until the Speedy Foundation provided the seed money about 10 years ago to restart it. Now, what are the resources that you're asking folks to provide for your organization to help in this effort?
Well, we are always recruiting volunteers. Most of our phone room is manned by trained volunteers, so volunteers are always welcome. And so we are consistently training new people to be responders at the hotline, and then working with community partnerships to increase awareness and funding and all of the necessary things that are required to keep the hotline going.
Jessica Torres with the Idaho Suicide Prevention Hotline and Dr. Anna Radin with St. Luke's. Thank you both for coming on today to talk about this very, very important endeavor that has recently been awarded to St. Luke's to research this crisis. Let's call it what it is, crisis going on in our state. Thank you for joining us on the News at 4.